This is Nurse Allen. I'm back with you to continue on over how to do PPE properly. So one of the first things you're going to need your gloves, you're going to need your gown, and you're going to need all your barriers that should be in place. So I have one on the table. So once I'm done draining the urinary bag, I will be putting it into a graduate container. I have my alcohol wipe. So I have all of my supplies in place. So before I go in, she's going to tell me to put on my PPE. So I'm going to put on my PPE. Now, depending on where you work or the place you go, they may have different gowns. Most of them, you apply them the same. However, just the way that you have to tie them, put them on at the bottom here, they may just have the elastic band. So this one, we have the little band on the bottom. So you want to just make sure everything is on properly. And when we get to that point, I will go over that a little more. So the first thing we want to do is tie our gown. Make your little bunny rabbit, make sure it's tied. I even keep my hair in there so it's out of the way. I'm going to make sure all surfaces in the back are covered. If you're a little heavier, don't worry about it. Just cover up as much as you can. Now, sometimes depending on the gown, one gown may have where you have to strap around, but you always tie your gown in the back because anything can be getting on the front, urine, feces, okay, pus, anything that you're dealing with can potentially be contaminated. That is the reason that you're wearing your gown to begin with. So now we have on our gown. Now we're going to put on our gloves. So you're going to put on your gloves. Now, if you have the one that has just the rubber around it, I just sometimes take my thumb and I'll do it on the other one. I usually, if you have the one that has the elastic around the band here, I just kind of, if I didn't have it, I'll take my thumb up a little further, use my thumb, have it kind of up so that it gets covered up in my gown. So everything is inside the gown. So you should look like this. And then you do a little quick turn around and show that you're all covered up to your proctor. You got your supplies out. You got everything set. Now you're ready to start your skill. Now, most of the time when you're in true isolation, all of this will be done outside the room. But because I'm just showing you, just know that for all intents purposes, you would don and doff before you come into the room. You would not be doing this in the patient's room. This would be done outside. There's an isolation cart or a bag on your door. I happen to have an isolation cart, but you would have an isolation cart. The sign would be on the door that says, stop, do not go in until you talk to the nurse. The nurse would give you further instructions, and it would also be on your care plan or your Cardex what you should be doing in that patient's room. So, but for testing, I'm just showing you. So we're just going to put on our stuff right here so that you can see me. Okay, so now we've donned and doffed. We got all of our supplies out. So what are we going to do next? We're going to go over to our patient. How you doing, Miss Jones? I'm going to just kind of move things out of my way so that I can work. Miss Jones, I'm just going to move your call light out of the way and move your cover. I'm going to check her line for kinks and coils. That is one of the things you want to do. You want to make sure you're checking for kinks and coils so that the urine is draining properly, right? It's supposed to be below the bladder. So now that I've checked everything, I'm going to pull all my supplies closer to the catheter. Now, depending on what kind of bag or catheter you have, they all have different mechanisms how you take them apart. So you want to know the one that you're using. Make sure you ask your proctor to even demonstrate if you do not know. This one happens to come down this way. You want to make sure that it's locked. You want to push it down and you want to open it and drain all the urine into the bag. Okay, once you drain all the urine, you don't want to touch any parts of the catheter or the bag, the graduate cup that you're measuring it in. Once you're done, you're going to close it off. Then you're going to take your alcohol wipe and you're going to clean that surface and put it back into the housing. Now, once you put everything in the housing, you're going to pick everything up, take it to a level where you can measure the urine. Mind you, I put 2 barriers down. That's just me because I want to make sure that I'm not having too much cross contamination on her table. So I have 2 barriers, the one I had here, but you only really need the 1 barrier because you can be doing this in the bathroom, at the sink, okay? But we're going, for all intents purposes, this is the bathroom sink. So, but I put double barrier. Now I'm going to look down, and proctor's going to say you have to measure in mLs. She's going to give you a sheet prior to starting. You're going to print your name at the top and sign at the bottom. And it's going to have various boxes, just like you would in the system, where to document urine output. So you would look at it. On this one, I have 275 cc's. I would make a mental note of that 275 cc's. Then I would discard my urine I'm sorry, I'm getting tongue-tied. I would discard my urine into the toilet. Once I discard my urine into the toilet, I would get a paper towel, turn on my water, rinse out my container 3 times. Once, rinse it twice, rinse it 3 times. Grab my paper towel to hold this. Grab another one, clean it out. I'm sorry. Grab one to clean it out. Clean this one out. Throw that one away. Grab another paper towel. Clean the outside. And then I'm going to go put this away. So now, and then I'm going to throw all my paper towel that I used into the garbage can. Now I'm going to throw all my other supplies away into the trash. So everything is now thrown away in the trash. Now the next part of your skill is taking off your gown and your gloves. What comes off first? It's a test question as well, so take note of it. When you're taking off any of your supplies, what you put on last comes off first. So what we're going to be taking off are our gloves. So you're going to pinch your glove in the middle, ball that up in your hand, take your 2 fingers, go up under the glove, take your glove off. Those go into the dirty, why do I want to keep calling it dirty garbage? To the garbage can. Now, your hands are clean because we hand sanitized before we started the skill. Although I didn't show you that, I hand sanitized. And if you make that mistake, you just say correction. I hand sanitized before. You only have 30 minutes. So if you make a mistake in the skill, you just go back and correct by saying correction. So the first thing, you're going to hand sanitize because I told you that before. Now we're going to take and untie our gown. So once we untie our gown, you're going to untie your gown at the top, like so. And then I'm going to untie my gown in the back, like so. Now, this is where I see a lot of students go wrong when they're coming in to take off their PPE. The proper way to take it off is you're going to take one of your hands, opposite side, go inside the gown, turn it inside out. So your hand is in the inside of the clean part of your gown, and everything that's dirty is in the inside. You do the same thing on the opposite side. You're going to take your opposite hand, pull it through, clean to dirty. Then you're going to take your gown and you're going to roll it away from your body and discard that into the trash can. Now that you're finished doing all of your skills, hands are clean. At this time, I can go to my patient and fix everything, but fix all her things like her top cover, because what was contaminated was in her Foley catheter, which is her urine. Make sure she has her call light. Then I would go wash my hands. So how do I wash hands? Now, everyone differs with this one, but the way I teach my students, you're going to turn it on with paper towel because we don't know what contaminants are on that sink, right? So we're going to turn it on with paper towel. We're going to turn on the water, adjust it to our temperature. We're going to wet our hands. We're going to wash our hands vigorously all the way up to the wrists, between the fingers, using your fingers to rub in between. I'm getting inside my fingernails, singing happy birthday 3 times, counting or happy birthday, ABCs, 1 Mississippi, 2 Mississippi, whichever you were taught. After I've washed my hands, a minimum of 20 seconds, then I'm going to rinse my hands. I'm going to rinse all of the agent off of my hand. Once I rinsed all the agent off of my hand without touching the sink, I'm going to grab a paper towel and I'm going to dry my hand. Then I'll take another one and dry my other hand. All the way wrist down, getting all of that water, dripping water off. And mind you, when we're washing our hands and we rinse, we don't flick. We do our hands like that, and then we dry each hand. Then I grab my last paper towel and turn off the water. Then I'm going to turn around and look at my environment and make sure that I do everything. So when I go to my patient, before I tell my proctor my skill is complete, I'm going to triple check that I did everything mentally. So I'm going to look, did I knock on the door? Did I announce myself? Did I explain to the patient what I was doing? Did I provide the patient privacy? Let me open up my privacy curtain. The privacy curtain is now open. Did I check for kinks and coils? Yes, I checked for kinks and coils. I did my hand sanitizing. I grabbed my supplies. What were the supplies for this particular skill? For this particular skill, I needed alcohol wipes, a barrier for the table, and a barrier for the floor. I measured the urine. I rinsed out all of her supplies. I did not cross-contaminate. I put them away with paper towel. I washed my hands. All parts were done. I'm going to triple check to make sure I make that correction, because if you didn't see me do my hand hygiene in the beginning, correction, I hand hygiene before I started the skill. So that way she can give you credit that you did your hand hygiene, okay? Because you only have 30 minutes. So you've done everything. Now you can make that mental note. Yes, I did everything. So now you're going to go out to the proctor and you're going to fill out the paper that you signed in the beginning, that you printed your name on, you signed at the bottom, and then you put how much, which was 275 cc's of urine. Then you're going to document that, and then you're going to tell your proctor at that time your skill is complete. Now, this is how you are successful with headmasters when you're doing your skills, step by step. So I just wanted to show you how to do catheter care, not catheter care. This was dawning and dolphin, and emptying a urinary drainage bag and measuring urine. So now that we've done that, we can move on to our next skill if that was what you had to do next. So that was your first skill that you had to do for headmaster. You may have 3, you may have 4. So then she would tell her your skill is complete. Then you'd move on to your next skill. Have a nice day.